Hey there, science fans! We've got a situation here in Massachusetts. A town called Plymouth has closed its parks at night. Why? Because of a disease called Eastern Equine Encephalitis, or EEE for short. It's serious stuff spread by mosquitoes. A man already got sick with it, the first case in years. That's why everyone's on high alert. The state's sending out planes to fight mosquitoes. It's a reminder that even tiny bugs can cause big problems. But don't worry, we're going to break down everything you need to know about EEE so you can stay safe. The affected areas are being closely monitored. Community health workers are spreading the word to keep everyone informed. Remember to use mosquito repellent and stay safe, especially during peak mosquito hours. For more information, visit your local health department's website. Stay tuned for more updates. So, what exactly is EEE and why should we be concerned about it? It's a virus, and it's not new to the Bay State. Scientists first discovered it here back in 1938, making it a long-standing issue in the region. EEE mainly affects horses and birds, causing significant health issues in these animals, often leading to severe illness or death. But guess what? Mosquitoes can pick it up and pass it on to us humans, making it a significant public health concern. The good news? Human cases are pretty rare, so there's no need to panic or be overly worried. But when they do happen, EEE can be very dangerous and life-threatening, requiring immediate medical attention. That's because it messes with our brains, causing swelling, inflammation, and other severe neurological problems that can be devastating. It's important to remember that while EEE is rare, its impact can be quite severe, especially in vulnerable populations like the elderly and young children. We need to stay informed and take preventive measures seriously to protect ourselves and our communities from this dangerous virus. Simple steps like using mosquito repellent, wearing protective clothing, and staying indoors during peak mosquito hours can make a big difference.
By staying vigilant and proactive, we can reduce the risk of EEE and keep our communities safe and healthy.
Knowing the symptoms of EEE is crucial for early detection and treatment. It can look like the flu at first, with fever, chills, and aches, making it easy to overlook. But here's where it gets tricky. Sometimes, those flu-like symptoms disappear, giving a false sense of recovery. People think they're in the clear, but then, bam! EEE can hit back even harder, catching them off guard. This time, it's serious stuff like a stiff neck, really bad headaches, and intense discomfort. Confusion and even seizures, which can be life-threatening. If you or someone you know has these symptoms, especially after a mosquito bite, get to a doctor ASAP. Early intervention is key. I've lived here for years, and I've seen how quickly things can change, especially with health issues like this. It's scary to think that a mosquito bite could lead to something so serious, affecting our health drastically. We really need to be vigilant and protect ourselves and our families by taking preventive measures, like using repellent and wearing protective clothing. Simple actions like checking mosquito nets and ensuring windows are closed can make a big difference in staying safe. Let's talk about mosquitoes, those pesky insects we all know and, well, don't love. They are more than just a nuisance. They can be dangerous and even life-threatening. They're the main culprits behind EEE, or Eastern Equine Encephalitis, a serious disease. Think of them like tiny flying syringes, injecting and extracting with every bite they take. An infected mosquito bites a bird, picks up the virus, then spreads it to other animals or people through subsequent bites, continuing the cycle. The good news is, we can't spread EEE to each other directly, human to human. But we can get really sick from it, with symptoms that can be severe and sometimes even fatal. That's why it's so important to avoid mosquito bites in the first place, by taking preventive measures seriously.
Exactly. Simple actions like using insect repellent, wearing long sleeves, and staying vigilant can help. and avoiding peak mosquito hours can make a big difference in reducing our risk of EEE. Stay safe and be proactive in your efforts.
Section 5. Diagnosis and Treatment of EEE. Diagnosing EEE is like detective work for doctors. They'll ask about your symptoms, if you've been around mosquitoes, and might take some blood to test for the virus. They may also look at other test results to confirm the diagnosis.
Now here's the tough part. There's no specific cure for EEE. No magic pill, unfortunately. Treatment focuses on managing the symptoms and supporting the body's own defenses. Early detection is key. With prompt medical attention, patients have a better chance of recovery.
Section 6. Protecting yourself. Prevention tips for EEE. Remember, the best way to deal with EEE is to avoid getting bitten in the first place. So, channel your inner mosquito-fighting superhero with these tips.
Repel those bloodsuckers. Use insect repellent with DEET on your skin and clothes. Dress for battle. Cover up with long sleeves, pants, and socks, especially at dawn and dusk when mosquitoes are most active. Eliminate breeding grounds. Mosquitoes love standing water. Empty out any containers around your home. Screen them out. Make sure your windows and doors have screens to keep those buzzers outside. Light citronella candles and use mosquito nets for extra protection.
Section 7. Massachusetts towns on high alert. Right now, a bunch of towns in Massachusetts are on high alert for EEE. Places like Douglas, Oxford, and Sutton are at the highest risk. But even if you're not in those areas, it's important to be aware and take precautions. Mosquitoes can travel, so everyone should be vigilant.
Remember, mosquitoes don't follow town boundaries. Check with your local health department for the latest updates on EEE activity in your area. Stay safe and informed.
Section 8. EEE versus West Nile virus. A comparison. EEE isn't the only mosquito-borne illness we need to be aware of. West Nile virus is another one that pops up. Both can cause serious problems, but EEE is much rarer. However, it's also more deadly. The good news is, the prevention strategies are the same for both. So, by protecting yourself from mosquito bites, you're fighting back against multiple threats. So there you have it, folks. The lowdown on EEE. Stay informed, take those precautions, and spread the word, not the virus. Stay curious and stay safe. Remember, knowledge is power, and prevention is key. Act now to protect yourself and your loved ones. Together, we can make a difference.